Hello and welcome to Talking Development. Today we will be discussing the critical link between health, development and economic growth, because health is a foundational pillar for progress and prosperity of any society. But did you know that more than half of the world's population still lacks access to essential health services? This is why last year the World Bank set an ambitious goal to help countries deliver quality, affordable health services to 1.5 billion people. So to help us better understand what this means, I'm delighted to be joined by Monique Bleder, Global Health Manager at the World Bank's Health Department, and Rifat Hassan, Practice Manager for Health in Africa's Western Central region. Monique and Rifat, thank you so much for joining me here today. So Monique, I'm going to start with you. Why is this such an important initiative that we've launched? 1.5 billion is ambitious, but also what progress has been made since we launched it?
Right. Well, first of all, thank you for the opportunity. Really delighted to be here. And after the announcement, which is a year ago almost, a lot has happened. So first of all, we used a very bottom-up approach to work with all of the regions on regional strategies to look at where can we expand our current operations, really double down on implementation, and also look at new opportunities to engage to really further expand the reach of the program that we have. We developed the technical agenda, and so what are really the challenges to better health outcomes? One is more and better health financing, and so using existing resources better in a more efficient way, but also working with ministries of finance to prioritize health in the national budgets. Secondly, we need to revamp and update the primary healthcare services to be more responsive to recent developments, for example, new non-communicable diseases or the impact of aging on the demand for health services. Thirdly, we have the value chain and health ecosystem agenda, and so we work jointly with IFC on improving regulation, but also then ensuring that private capital from IFC can make those investments that are necessary to really expand services to that extent, and that are medical consumables, equipment, diagnostics, pharmaceuticals, often looking at local production. And then the last part is really central and a huge bottleneck, which is the health workers agenda. And so for this expansion, we expect to need at least 40 million new jobs in service delivery. We also established a new fund with $100 million in financing for all of the analytical work and the technical assistance and the knowledge program that is necessary to deliver with impact.
Wow. Really, I love the ambition, and it's amazing progress in just a year, frankly, to be able to add incrementally so many more beneficiaries. That's great. I also like your focus on doubling down on implementation, because it's not just about new commitments, it's getting more out of our existing programs. I really like that. Rifat, let me turn to you. How are your clients receiving this initiative that's been launched by the bank? Does it resonate with them? And what type of issues do you find you encounter when you discuss it with your clients?
I think the issue and the topic and the target 100% resonates with them. And it resonates with them because they know, even better than we do, that health is a major issue in our countries in West and Central Africa. 1.8 million maternal and child deaths annually are taking place in our region, which accounts for 33% of all under 5 deaths and 44% of all maternal deaths. The number of stunted children have been increasing, and we know that more than 1 in 5 adolescent girls are either pregnant or have already started childbearing, which has multi-generational effect. The health systems in West and Central Africa are the most vulnerable in the world, whether we're talking about weather-related risks or food insecurity, fragility and conflict, and pandemic risks. So because of this, it really, I think, hits home, and they feel it. In terms of the 1.5 billion target, the Africa West and Central contribution is 200 million.
Okay.
So that's what we are hoping to not only achieve, but hopefully exceed by the time we get to 2030. So when we talk about frontlines first, it's about primary healthcare, human resources, addressing demand-side barriers. Fixing finance means not only spending more, but also spending better. What are we spending on? Can we reduce inefficiencies? I think this is particularly important as the development assistance for health landscape is rapidly evolving. But then also we need to support to actually achieve results. So where we have existing operations, we really need to drill down and provide that intense implementation support to help our clients actually achieve what they've set out to achieve.
I was actually going to ask you, are there any concrete examples you want to share?
There are a couple of really exciting ones. So one is for Nigeria. We have a new operation called Hope PHC, Primary Healthcare. It's $570 million. And it's really aiming to improve the quality of essential services, but also to improve the resilience of the health sector. It's particularly exciting because we're working with our governance colleagues as well to address some of the governance around human resources for health challenges. So it's really a multi-sectoral effort on this front. And finally, we're about to launch a regional platform for nutrition in ECD to really address some of the stunting issues and anemia that exist in the region. And we also know that investments in nutrition and early childhood development will actually give much more returns in the longer term in terms of human capital and economic growth. So it's an exciting time. There's a lot going on. We are ready to scale up and speed up the support for our clients. And I think they're really excited to hear about it as well, and they're ready to go.
Wonderful. And I love how you're tying it into operational effectiveness and efficiency that we've been pushing on speed and scale and leveraging what you already have using additional financing, because I sometimes find that the quickest way to get quicker results is to actually, again, use what we have and build it out and not start from scratch. So really like that. Monique, let me come back to you. Healthcare is also one of 5 pathways we've identified to really what we see as a major opportunity for our institution to make a real contribution to, which is job creation. Yeah. So could you talk a little bit also about how do you see the broader implications of setting this goal and how does it fit into the job creation agenda?
Yeah, and there's a really great link there. And as you know, when we look at high-income countries, the healthcare sector employs 20% of total employment, and in low and middle-income countries, that's 10%. So it's a really significant employer, particularly also for women. But in low-income countries, for every job we create within the health sector for service delivery, there are 3.4 jobs created in accompanying sectors that are needed to deliver those quality services. And that's so there's a huge opportunity there, and it was recently discussed at the Jobs Council, and we have developed a work program for the health practice to look at 3 different areas. One is the direct expansion of the workforce in combination with AI, technology and innovation. The second one is a collaboration with IFC, where we would look jointly at improving the regulatory environment for these investments of private capital to be successful. And the third one is around the care economy. And so really, because of the demographic changes in the world, seeing much more care needs for the aging population, which is another opportunity to create jobs.
That's wonderful. So I think one of the important parts for us as an institution is to see how all of our major initiatives overlay and reinforce each other. And I do feel with this, you're touching on so many different issues. You're touching on, of course, good healthcare in and of itself. You're touching on job creation. You're touching on education and nutrition, which for me is so important, but also infrastructure, because at the end of the day, it's very hard to do this without electricity, so that you have the right reinforcing and supporting infrastructure to be able to actually provide the healthcare services, store medication. So I like how we're mobilizing through selective high priority strands towards goals, but they actually also reinforce each other. So thank you so much. Thank you both. Thank you for sharing your insights. And as always, let me share with you what my take is. Investing in healthcare transforms societies, creates opportunities, and creates jobs. Better health and nutrition outcomes lead to stronger human capital and a productive population. In short, health works. Private companies, public institutions, as well as governments all play a vital role in improving health outcomes and driving economic growth. I look forward to working with our client countries and partners to advance this agenda, addressing health needs while creating millions of healthcare jobs and strengthening global health security. That's it for today. Thank you for watching and see you next time on Talking Development.